Hi everybody, today we are here at Aesthetic Assets, a face and body rejuvenation center, and we are here today with William, who is my model for today, and Pam, who owns the facility and is also going to be doing these treatments on William. And what we wanted to talk to you about today is how men are coming in and keeping young by doing some great treatments. And Pam, what are we going to do today?
Yeah, sure. The guys are starting definitely to do more non-surgical face and body rejuvenation. We're seeing about 15 to 18% of our total clients are men. They just don't want people to know about it, and so they're doing more subtle treatments like injectables that will, with Botox and Dysport, that will smooth the lines and wrinkles and just give you a softer, more youthful appearance. We also see guys doing fillers like HAs or Sculptra, which will volumize the face and replace some of the deficits that we lose over time.
Awesome. And William is actually icing his forehead right now because we are going to be doing Dysport on William to get rid of some of those wrinkles in his forehead. No offense, William. And so by icing his forehead, we're restricting the blood vessels so that he does not bruise.
A couple of purposes, yes. We want to decrease his risk of bruising with the cold compress, but it'll also make the treatment more comfortable for him.
Yeah, good point. Okay, so what do we need to do?
Okay, great. So we're going to be using Dysport for William today. A lot of people use Dysport. It's common replacement is Botox. The difference between Botox and Dysport, there's really not a big, huge difference. It's kind of like comparing apples with apples. They're cousins. They do the same thing, and that is basically to stop the nerve and muscle from communicating with each other for about a period of 3 to 4 months. That allows the muscle to relax in the area that causes a wrinkle. So we're going to be treating William's frown lines today. And if you push your eyebrows together for us, William, push real hard. We're going to focus on this area that creates the 11s and also kind of drops his brows down a bit. Yeah, right there, William. So we're going to really relax this area and then raise your brows for us. We're going to also be relaxing these horizontal lines, or worry lines they're called. So those two areas. And then we're going to work around his crow's feet to soften that area as well. So the overall effect is just going to be an overall softening and relaxation of the upper face.
All right, well, let's do it. And
you know, go ahead and push your brows together hard. Perfect. And you can relax. I've got it. Just go ahead and relax for me. Good. Feel a little prick.
How was it?
Didn't feel a thing.
Okay, good. Perfect. So if patients do have a risk of bruising, Julie, we'll have them come off any anti-inflammatories, non-steroidal anti-inflammatories, about a week before. Push your brows together. Good. And relax. Got it. So aspirin, Aleve, Motrin, naproxen, ibuprofen, all those kinds of things will thin your blood and cause you to bruise a little more easily. Also, heavy alcohol intake. So you really shouldn't party like the night before you're going to have a facial injection.
So you see, anybody can do this.
Doesn't hurt.
There you go.
So some areas are a little more riskier in terms of bruising than others. Typically there's more vascular activity in the forehead and around the eyes. So we'll just get a better light over here so we can see a little better. Raise your eyebrows for me. Good. You're going to feel a little stick. So with this treatment, we like to stay a little bit higher, about halfway up the forehead. As you can see that these are the elevator muscles here. So if we go too far down and hit these wrinkles, raise again. If I try to hit these wrinkles lower on the forehead, it would actually cause his brows to get heavy and he wouldn't be able to raise his brows.
And I know a lot of people worry about that when they come and get Botox or Dysport. So you want to make sure when you're coming to go do Botox or Dysport that you're going to a reputable place. So of course, Aesthetic Assets is a great place to come. And for my local people that live in Scottsdale, this is located right where the Ice Den is. So really easy to get to, right off of Bell Road and the 101.
Good. Yeah, all of our nurses are board certified by Arizona State Board of Nursing, and we all have certification for aesthetic injectables. We'll come back in 2 weeks for a follow-up. Typically this port will start working in about 24, 48 hours, 3 to 5 days, and it takes 2 weeks to see the full effect. We like to do really conservative treatments at Aesthetic Assets. We always err to treating at the manufacturer's recommended dosing. We will, for women, the dose in the glabella region, or where the frown line is 20 units. For men, Botox and about 60 units of Dysport. And for men, you can add probably about 15 to 20% more product, just because their muscles are stronger.
You're done already?
Yeah, all done.
Wow, that
So
didn't
just
hurt at
gonna-
all.
Just gonna-
All right, well, I am so excited to see the results, so stay tuned and we'll come back. I'll give you the befores and afters, and I hope everybody has a great day. Bye.
Bye. Thanks, Julie.